to the federal government to do more, and a group of tribes are suing for control of $8 billion in coronavirus funding. Joining me now is New Mexico Representative Deb Haaland. She is one of the first indigenous people to be elected to Congress, one of two members of Congress of indigenous background. Congresswoman, thank you for joining me. I appreciate your time. Let's just talk about the factors at play here, particularly with Native Americans living on reservations. But even if they're not living in reservations, they often have higher incidence of heart rate and diabetes. In some reservations, there's a scarcity of running water, and there is a high concentration of people living in some households, all of which make the spread of the disease more likely and harder to treat.
Yes, absolutely. Thanks so much for having me, Ali. And yes, I mean, look, there's a pandemic going on right now, and so the communities of color who haven't had the best health care or infrastructure or just the fundamental things that people need to live. You're talking about the Navajo Nation, but tribes all over the country sometimes don't have running water, they don't have electricity, they don't have broadband internet service. Those are issues that we need to work on as a country, not just because there's a pandemic. So they're already behind the 8 ball when we come into this pandemic, and yes, it's devastating. Here in New Mexico, the population of Native Americans is 11%. The infection rate is close to 40%. So
wow.
I was on a Facebook Live event last night with President Nez. He's doing a great job as a leader of that community, and everyone's working hard. So yes, we're absolutely trying to make sure that the federal government lives up to its trust responsibility to tribes during this pandemic.
You make a point about a lot of people, there being a digital divide. A lot of Native Americans do not have the same access to broadband internet that everyone else does, which, by the way, is now everything we depend on, right? Our conversation right now is happening on broadband internet. So access to certain information, access to banking is more limited for Native Americans. You fought to have provisions in the last bill for Native Americans, but it's a little bit different. Native reservations, for instance, are not treated like states are or like cities are in their ability to get money out of that fund.
Yes, there's 574 recognized tribes here, federally recognized tribes here in the United States. That means that if they're federally recognized, the United States has a federal trust responsibility to those tribes, meaning that they're responsible for healthcare, education, law enforcement, housing. So yes, these are tribes, they're sovereign nations, nations within our nation. I want everyone to realize that at one time this was all Indian land, and when the United States made provisions or agreements for tribes to live in smaller communities so that the U.S. government could take the larger pieces of land, there were agreements made through treaties and executive orders and acts of Congress. So the United States absolutely has this trust responsibility, and that's part of what we're fighting for, to make sure that they live up to their obligations for health care during this pandemic. You have to realize that a lot of tribes all over the country are in rural communities. Sometimes it'll take them, 80 miles to get to a hospital or a clinic. This isn't an easy issue to deal with. So we are, as members of Congress, we're absolutely want to make sure that they have what they need during this terrible emergency.
Congresswoman, I'm going to ask you to stand by for a second, because a lot of the things you describe not only happen in the United States, but are happening all around the world with indigenous nations and indigenous people. I want to bring in our NBC News correspondent, Willem Marks, who's now reporting on how the coronavirus has the potential to wipe out entire cultures around the world. Willem, thanks for joining us. We aren't just talking about indigenous people here in the United States. You've been looking into the situation for similar groups of people in Brazil and in Russia and China.
Yeah, that's right, Ali. You know, if you look at the Amazonian groups in particular, there's about 800,000 indigenous people in that massive, massive region, largely in Brazil. And talking to immunologists there, like you've been pointing out there with the Congresswoman, it's not really that they're innately more prone to contract infections like COVID-19. It may be the comorbidities at play, whether that's poor sanitation, lack of access to healthcare, potentially some of the challenges that we've seen historically in that region could play out again if they don't have the immunity, like many of us don't have the immunity to the coronavirus. I was talking to a historian and author who's worked in that region the last 50 years or so over the course of this week, and he was describing in the 1560s you had Jesuit priests walking along the coast of Brazil and just leaving a trail of death with villages wiped out unintentionally by things like smallpox. Even over the past century, you had uncontacted groups inside the Amazon falling prey within a couple of years of contact with the outside world to influenza, to measles, wiping out 20–30% of their population. He said this could be catastrophic. It got into some of the villages that he's visited.
Wow.
But if you listen to the advocates for these people, they are really saying the Brazilian government is also to some extent at fault in terms of the provision of healthcare. Take a listen to Leila Salazar-Lopez. She's the executive director of Amazon Watch, outlining to me this week what she saw as the challenges for people in the Amazon region in particular.
There is no adequate health services. There are no adequate hospitals and resources available to treat the people, or even provide, emergency, canoes or helicopters to fly people out. The threat of COVID-19 into the Amazon to indigenous peoples and the peoples in isolation is a very real threat of possible ethnocide.
And that threat exists, of course, for people, Ali, in places like Russian Siberia. You see the Russian healthcare system already under huge amounts of strain over the past few days as the virus spreads there. People we've been speaking to from some of the tribal groups on the Russia-China border in the Siberian region saying that the remoteness makes it incredibly dangerous for people if it gets inside their communities. And one of the other common factors, people do live cheek by jowl. They live in very close communities with one another. That makes things like social distancing incredibly difficult. And the necessary education, the idea that you need to wash your hands, you need to keep a distance from one another. A lot of the advocates we've been speaking to over the last week or so saying that's not information that's necessarily filtering through from governments to these groups.
Willem, I'm grateful for your reporting on this, and Willem's been reporting not just on Brazil, but on Russia and China, on Native groups in Ecuador, in Canada, and the threat that it poses to them. And Congresswoman, thank you for the work that you did in getting protections for America's indigenous people into the CARES Act. And of course, there's going to be another version of that. And I think we really have to think about some of the things you've talked about, including that digital divide and the effect that it has on our Native communities. Thank you to both of you. New Mexico Congresswoman Deb Haaland and NBC's Willem